Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy channel. And we are also taking some classes who are interested to learn Ayurveda. This particular class is regarding the Charak Uttarardha. And you know that in Charak Uttarardha, there are basically three sthanas are there: Kalpasthana, Siddhisthana, and then of course the main is a Chikitsa Sthana. So we have completed the basic idea. I am not saying each and every line I am teaching you, but yes, Dr. Deshpande is giving a good confidence, and the students are requested to purchase minimum textbook of every subject, and whenever the lecture finishes, they can make their own notes based on the previous question papers. So today is a date 26th of November 2023. This is the lecture of Charak Uttarardha. But before that, actually starting this particular topic, please carefully hear the chapters of Charaka Samhita Kalpasthana, where the different recipes are given for the Vamana karma and basically Virechan karma. So in Charaka Kalpasthana, first 6 chapters are mentioning the very interesting plants or herbs which are useful to give the Vamana, therapeutic vomiting. And next 6 chapters are related with the Virechana karma. So carefully hear the names of the plants that are Charaka Kalpasthana revision. Madana Kalpa Adhyay, number 1, Charak Kalpasthana. Second, Jimutaka Kalpa, Jimutaka in Marathi, Devadangri, Jimutaka for Vamana. Third chapter, Ikshwaku Kalpa, that is Kadu Dudhibhopra for Vamana. Fourth chapter, Dhamargava Kalpa, that is for in Marathi Kadu Gosala for Vamana. Next is a 5th chapter, Vatsaka Kalpa, that is Kuda in Marathi or Sanskrit for Vamana. Then 6th chapter, Kritavedhana Kalpa, that is Kadu Dodka in Marathi for Vamana. We are talking about Charak Kalpasthana revision, only chapter names. Next 6 will be Virechan. Chapter number 7, Shama Trivrit Kalpa, that is Nishottar in Marathi, Shama Trivrit. Chapter number 8, Chaturangula. Chaturangula means Bhava or Aragvadha for Virechan, of course. Chapter number 9, Tilvaka Kalpa, that is Lodhra for Virechana. Chapter number 10, Sudha Kalpa, that is Snuhi for Virechana. Chapter number 11, Saptala Shankhini for Virechan. Chapter number 12, Danti Dravanti Kalpa for Virechana. In the same way, please listen carefully. So you can write down in the notebook that Dr. Deshpande has given the list, narration, audio about the Charaka Kalpasthan chapters. Now I am going to tell you Charaka Siddhisthana chapters. Just listen carefully, and if you write down Charaka Siddhisthana, name of the chapters Dr. Deshpande has mentioned. Chapter 1, Kalpana Siddhi. Chapter 2, Panchakarmiya Siddhi. Chapter 3, Basti Sutriya Siddhi. Chapter 4, Sneha Vyapat Siddhi. Chapter 5, Netrabasti Vyapada Siddhi. Chapter 6, that we are going to look right now, Vamana Virechana Vyapada Siddhi. Chapter number 7, Basti Vyapada Siddhi. Chapter 8, Prasrut Yogiya Basti. Chapter number 9, we are talking about Charaka Samhita Siddhisthan, name of the chapters, Siddhisthan. Chapter number 9, Trimarmiya Siddhi. Chapter number 10, Basti Siddhi. Chapter number 11, Phalamatra Siddhi. This is regarding the Pashu Chikitsa. Chapter number 11 from Siddhisthan, veterinary. Charaka Siddhisthan, chapter 11 about animals, prani, veterinary science. Chapter number 12, Uttarabasti Siddhi. Okay. So my dear friends, once again, we are narrated, we have made a revision. We had made a revision about chapters of Charaka Kalpasthan and chapters of the Siddhisthan. Now we will see chapter number 6, Charaka Siddhisthan, Vamana, Virechana, Vyapat Siddhi. Vyapat, complication, Sanskrit word. Vyapat, complication. Vyapat, complications. Complication of Vamana, ulti, therapeutic vomiting, and Virechana, therapeutic purgation. Now, for the purpose of shodhana, these are all panchakarma detoxification. Shodhana karma, Vamana, Virechana, Basti, Raktamokshana, Nasya. Vaman for predominantly kapha, primarily, secondary for pitta. Virechana, primarily for pitta, secondarily for kapha. Basti, of course, for vata dosha. Raktamokshana, for blood, that is rakta dhatu, dushita rakta dhatu, and prakupita pitta, to relieve the heat from the body. And nasya, urdhva jatru vikareshu visheshat nasyam ishyate. Jatru means clavicle. Clavicle, jatru, urdhva, up. Urdhva jatru vikareshu, vikar, diseases. Visheshat nasyam ishyate. So all the facial problems, brain problems, ENT problems, ear, nose, throat, ophthalmic problems, nasya. Chapter number 6, only Vaman Virechan. Rutu, seasons, Vishesha Rutu, Sadharan Rutu. These are important. Pravrut, Sharad, and Vasanta. Pravrut is near to the Varsha Rutu, nearby, Shravana Bhadrapada, in Marathi month. Is parallel to the Varsha season. Okay, so in Pravrut we give the Basti. Write down, please write down. Varsha Rutu, Vata Prakop, Varsha Rutu, Vata Prakop, Basti. Sharad Rutu, Pitta Prakop, Sharad Rutu, Pitta Prakop, Virechan. Raktamokshana. Sharad Rutu, Pitta Prakop, Virechan and Raktamokshana. Vasanta Rutu, Kapha Prakop. Vasanta Rutu, Kapha Prakop, Vamana. Vasanta Rutu, Kapha Prakop, Vamana. In this way you have पाठ करून टाकायचं, याद करना चाहिए, learn by heart. Okay, now we will go further step by step. Let me allow to move the screen for you, my dear friends. Let me mark you. Just wait. Concentrate, focus. Shodhana has to be advised only after adequate snehana and svedana. Snehana and svedana are called, please write down, purva karma. I have given you the example, pre-operative, operative, and post-operative. Similarly, purva karma, pradhana karma, paschata karma. In purva karma, always snehana and svedana. Snehana, that is medicated ghee internally, orally. Externally, oil, snehana, lubrication, unctuousness. Svedana, fomentation. Sarvanga sveda. Sarvanga sveda, why? Svedana peti, chamber for fomentation. You might have been seen, everybody should go to the Panchakarma department. If you want to understand Siddhisthana, I request each student must visit their hospital and especially Panchakarma department with apron and accord and requesting to the teachers, sir, please allow me to see some things from the Panchakarma. I am not a final year student, but I want to see because I have Charaka Siddhisthana and where Panchakarma complications have mentioned. So let me see what is there. Okay. So when patient is atisnigdha, lot of oil, lot of ghee internally, instead of sneha virechana, ruksha virechana is advised. Simple thing. When the patient is, for example, obese, overweight, snigdha virechana is not given. Ruksha virechana is given. So there are two types of virechana. Snigdha virechana, ruksha virechana. Okay. When the person is having indigestion, Vamana and Virechana should be avoided. Remember this thing. So whenever you do Panchakarma, first always Deepana and Pachana is done for first few days. Then Snehana starts. Because Ama Pachana is very important. In Ama condition, no shodhana. In Ama condition, no shodhana. Remember. So you have to ask whether you have the good hunger, your stools defecation normal, okay. No gas, no indigestion. Then only you can start some treatment of panchakarma or shodhana. Remember this point. Okay. During this condition, Vamana drugs cause Virechana and Virechana drugs cause Vamana. Opposite, unwanted effects, unwanted, non-wanted effects. If you give the Shodhana in Ajirna, indigestion, that is not correct. Remember my words, write down. In Amavastha, no Shodhana. No Shodhana. So, best Amapachak Dravya is Musta, Agre Sangraha, the best medicine for Ama. Please write down, best medicine. What is that? Nagarmotha. Best medicine. Then Musta. Musta means Nagarmotha. Same. Musta, Sanskrit word, Nagarmotha, Marathi word. Okay. Then simply in our practice, we also give Amapachaka Vati. Ayurveda Rasashala Pune, Maharashtra state. They are preparing Amapachaka Vati, tablet. Vati means tablet. Even simple, if you don't get, Shankavati can be given. Chitrakadi Vati can be given for Amapachana. Before Shodhana Karma. You can give Trikatu Ghanavati or Trikatu Churnavati also available. Trikatu Suntamaricha and Pippali. All these dravya, Chitrakadivati, Shankavati, Amapachakavati, they are making your digestion good. Then start the Panchakarma. Matra Yukta Aushadha. Slowly, steadily go up. Here, we are reading proper dose. Matra means dose, DOAC, which does its therapeutic action. That is the proper dose. Gets digested easily, relieves the disease, and in meantime does not produce any new disease or any new discomfort to the patient. So when you give in the proper dose, all these benefits are there. Good effects. Disease will be cured. Good relief and no unwanted complications. This is the benefit of Matra Yukta Aushadha. Okay. Causes of medicine to produce complication. Kai kabar, sometimes the medicine also can cause complication. Why? Why? See the reasons. 6 reasons. Administration at wrong time. Administration in inadequate dose. Dose is not proper. The effect will not be there. Effect will not be there. Administration in excess. So complication will be there. Administration of old or expired medicine. Always see the expiry date on the medicine. Allopathy, Ayurveda, homeopathy, everywhere there is a expiry date should be mentioned. Should be mentioned. Not triturating medicines with drugs having the same action. Same action. Triturating. मराठीमध्ये आम्ही खल करणं म्हणतो. घोटायचं औषध. खलामध्ये घ्यायचं खलबत्त्यामध्ये आणि घोटायचं. You have to rub. You have to make the trituration with mortar and pestle. English words, mortar and pestle. So, for example, 64 pimpali churna. So, pimpali churna is taken and it is triturated in the pimpali kadha. So, a lot of time trituration is essential. Medicines are not properly fortified. Fortified is samskar. Proper samskar are not done. So, these are the reasons why there is no effect or bad effect of the medicines also. So, these 6 reasons you must remember. Now, slowly and steadily, I would shift to the right hand of the page and we will go up. Just wait, my dear friends. Yes, yes, this is the right. Slowly go up. Okay. I will mark for you so that you can concentrate on that. Am I right? Complications produced because inadequate or excess shodhana aushadhi are given or shodhana is given. 10 are there. For example, Admanam Parikartihi Cha. Cha. This is Cha. Cha means and. Sanskrit Cha, in English and. Admanam Parikartihi Cha. Stravo Rutgatriyor Graha. Jivadanam Savibramshaha. Stambha Sa Upadravaha Klamaha. Ayogat Atyogat Cha. Ayogat Atyogat Cha. Dashayita 10. Dasha 10. Vyapado Mata. Preshcha Vaishajya Vaidyana Vaikunasya Aturasya. So, Ayogajanya problems, 10 problems. I will change this marking so that it will be more comfortable for you, my dear friends. Can you see Vyapat complication? Ayogajanya. Effect will not be there. Adman, distension of abdomen. Strav, discharge. Maybe watery discharge from the mouth, watery discharge from the rectal region. So many strav or inside also. Srotasa, all the secretions will be more increased in all the srotasas, respiratory, digestive tract, everywhere more and more secretions. Strav. Ritagraha, here, cardiac region. Tightness in the cardiac region. Rhythm means heart. Gatriyor graha. Anga graha. Gatra means anga, body parts. All over the body, there will be pain. That is called a body ache. A-C-H-E, body ache. Upadrava. Lot of complications will be there. Klama. Klama, very interesting word, klama. Tired without exertion. Can you write down the interesting meaning of the klama? Klama is a tiredness without exertion. That is klama, lassitude. Atiyog, this is ayog. Now atiyog, if lot of irritating, because of the heavy dose or heavy type of the Vaman or Virechan, what will happen? Irritation will be there in the all cell membrane. Parikartika, that is fissure in ano. Jiva Dan, that is loss of vital fluids like hemorrhage, blood loss will be there. Vibhransha, that is especially Gudabhransha, rectal prolapse, or Saudhnya Bhransha, loss of consciousness, unconscious, drowsy will be there, patient. Slowly we will go down to understand this page. Can you see, my dear friends? Parikartika. When strong medicines are administered to a person of Guru Koshtha or Mrudu Koshtha, who is weak, patient is very weak, low weight patient, debilitated, weakness will be there with the chronic illness like tuberculosis and cancer, or in case of the Ama dosha, if there is Ama dosha, the medicines expel the excessive dosha with Ama and causes cutting type of pain at anal region, which is called as a fissure in ano with frothy and bloody stool. There will be per rectal bleeding. Oh my God. So these are the complications. We will try to go on the next page. Then we will shift the page on the left side first. Okay, here we can see the complications and their management. Parikartika chikitsa. Chikitsa is a management. In case of Amadosha, you can give fasting, langana, pachana, amapachana, and rukshana, clearing of the srotas. Srotasa shodhana, rukshana. In case of the krusha sharira, when there is a wet loss, madhura rasayukta padartha sevana. Food stuff having the sweet taste and no pungent, no sour, because these are irritating taste. Sweet taste is good. Sudhaning. Brohana, nourishing. And amla mishtrita lahu ahar. Very light diet, easy to digest. Jivadan. What is Jivadan? When strong medicines are administered to a patient with mrudu koshta, with minimally vitiated dosha. Dosha prakop is not strong. Very little dosha prakop, and still you are giving strong medicines. Huh? Shameful. It's not correct. So, minimally vitiated dosha, alpa dosha prakopa. Then medicines not only excretes the mala and dosha, but later on expels blood, rakta, as well as, so that is called as a hemorrhage. And you know that there may be hemorrhagic shock, shock. Shock means less blood supply to brain. Shock will be there. You understand? Shock. So what is there? Lot of sweating will be there. Blood pressure will be dropped down. BP will be low. Normal. What is the normal? 120 by 80 mm of Hg. Am I right? So for the low blood pressure, systolic above 120 figure should come down below 60. Are you getting my point? For hypertension, diastolic is important. For hypotension, systolic is important. So when in spite of 120, if it comes down to 60, that is called as a hypotension or low blood pressure in serious condition like hemorrhagic shock. Sweating, BP drop, pulse will be fast but feeble. So these are the some important signs or symptoms for shock. Okay. Now, Jivadan Chikitsa, Jivabhisandhan, fresh blood transfusion, Mruga, Gau, Mahish, and Aja should be given to drink. Nowadays, it is very difficult to give the animal blood for drinking to the human being. This is only Samhita description. I personally don't agree with this at this era, 2023. We have the blood transfusion, we have the blood banks. Why to take the animals? That time, Gurukula Paddhata. You know, all the people were living in the jungle, forest, and then Guru and also Shishya, they are using these animal products. Are you understanding my concept? Okay. Basti. Basti should be also given. Darbha Mula Churna mixed in above blood, this blood, or you can make Kshira Pak. Kshira means milk. So medicated milk can be prepared. Or of Priyangu, Gambhari, Badar, Darbha, and Ushir. These medicinal herbs can be used, or even you can give Sheet, Picha Basti. My dear friends, this Picha Basti, please write down. Very interesting. I will tell you, very interesting. Picha Basti. Why am Deshpande sir is stopping? Because students are expected to write. That's why the lecture is always slow and steady. Picha Basti. Practical things Deshpande sir always insist. Write down, write down. Mocha Rasa Picha Basti. Please write down. Mocha Rasa Picha Basti. Very interesting in practice. Sir, where are you going? When you give this Mocha Rasa Picha Basti, I am giving whenever there is ulcerative colitis. Please write down. Ulcerative. ULCERTA. Ulcerative. TIV. Ulcerative colitis. COLITIS. Inflammation of large intestine. There we use best results. Whenever there is a perrectal bleeding, PR bleeding, Mocha Rasa, Picha, Basti, best. What is sir Mocha Rasa? Please write down. Shalmali Niryasa. What is Mocha Rasa? Shalmali is the name of the plant. Shalmali. Niryasa. Niryas. Shalmali Niryas. Cooked in the milk. And then Mocha Rasa Picha Basti by slow drip. It is not given fast. Always. Enema pot, put it there. All these niryas and milk. That means prepared milk. And then drip, drop by drop, drop by drop, drop by drop. So it should not be given fast. Dripping method. Dripping method. Mocharasa Pichabasti in ulcerative colitis. Yes. Whenever Pichabasti word comes, Deshpande sir giving practical tips. Okay. Now we will go slowly and steadily up. Next topic. Focus, concentrate. Complications produced when shodhana drugs are administered without subjecting the person to snehan and svedan. This always happens. I have seen lot of times that when you advise the patient, take this 150 ml today morning or so tomorrow morning at 7:30 after your rituals, morning rituals, deprecation, take this ghee. Second, after 2 days, take 100 ml. After 4 days, you take 150 ml. That ghee, that oil taking is not easy, my dear friends. Not at all easy. Some ghee, they are smelling so bad. Oh my God. Some tastes are very bad. For example, Panchagavya Ghrita, Mahatiktaka Ghrita. Doctor is prescribing, take this. Arey Baba, oh my dear, can you see, have you experienced that taste and smell so nauseating? The patient just telling fall, cheating to the Vaidya. Yes, I have taken. Yes, sir, I have taken 150 ml, 2 ml, one bottle. Oh, no. He is lying. He is a liar. Many times this happens. Doctor is believing, okay, I have prescribed, he has taken. And then give the Vaman and then the complications. So proper snehana and proper svedana is very much essential before giving Vaman or Virechan. So better way, what I recommend, at least for Vamana, I recommend, please take it from me. Take it from me. Admit the patient. Admit the patient for minimum save with nominal cost. Or at least call him in the OPD. Call him and ask to take the medicines in front of you. This ghee, medicated ghee, these oils, that your attendant should give him and ask him to drink. Then only you can believe that he has really taken that snehana. Otherwise, he will always cheat you and you will be in trouble when you will give Vamana, no proper Vamana. There will be a lot of complication and then the relatives of the patient will beat you. Remember my words, medico-legal problems, a lot of problems. Be careful. Okay. Complication produced when shodhana drugs are administered without subjecting the person to snehana and svedan. Without doing snehana and svedan, what will happen? Vibhramsha. In Virechan, of course, in Virechan, rectal prolapse or Bhramsha, Smruti, loss of consciousness. Second complication, edema, Shoth. Third, hiccup, Tama, darkness in front of the eyes. Pindiko Dveshtana, because of the dehydration. Cramps in the muscles. Kandu, because not proper cleaning and that dravyas are remaining inside and that causes the ama, that is itching. Urusad, tiredness of the thighs, and Vivarna, that is discoloration. Okay, so this is the complication because you have not done proper snehana and svedana. Okay, what has happened? I will have to check what has happened. Okay, basti, Vyapat, Siddhi. Okay, but I think there are some problem. Just wait, my dear friends. Just wait. Let me adjust everything. I think this page we have completed. Am I right? So I will try to go on the next page. Yes, here we are. We have to see this Vasti Vyapat now. After Vamana Virechana, next chapter has already started. Next chapter, immediate. Basti Vyapat Siddhi. This is a Charaka Samhita Siddhi Sthan, chapter number 7. We have already talked about Vaman and Virechana. The most complication of Vaman Virechana, my dear friends, is a dehydration. hypovolumic shock. You always tell in the orals and write down in the written examination, hypovolumic shock is the biggest complication for Vamana Virechana Atiyoga. Atiyoga. Because lot of fluid will come out. Okay, now we will talk about basti. Management of complication of basti. You know, there are two types of basti. Basti means what is English translation? Medicated enema. Please write down, medicated enema. Best chikitsa for Vata dosh. First is Anuvasana basti. Anuvasana is oil enema. Only oil, only oil. Only 50-60 ml. Only 50-60 ml. Anuvasana basti or Sneha basti. And second, what is the second basti? Yes, Asthapana. Write down the name, Asthapana or Niruha basti. In Asthapana or Niruha basti, there is oil, but there is also decoction. That is Kwath. There is also Kalka, that is paste, and plus that particular Sneha, oil or the ghee. Okay. So management of the complication of basti. The complications produced by improper administration of Niruha basti, I will mark for you and then we will see. Okay, focus. Ready? Na atiyogo, that means na atiyogo, klama, adhamane, hikka, hrit, prapti, urdhvata, pravahika, shiro, then garti, parikartaha, paristavaha. Okay, let us see. Ayog, signs of inadequate niruha. This is one complication. Atiyoga, ayoga and atiyoga. There is also mithya yoga. Now I will wait, and you are expected to write 3 words for any panchakarma. Any panchakarma, you write down these words, very important. Please write down. First is Samyak Yoga. Samyak, best. Proper treatment. Samyak Yoga. Samyak Yoga. Very proper. Then Ayoga. No effect. No. Ayoga. Atiyoga. Atiyoga is also complication. Atiyoga. Excess. Atiyoga. And last is Mithya Yoga. Mithya, improper. Not actually a yoga, not ati yoga, but something abnormal that is not expected. That is Mithya Yoga. So these 4 words in Ayurveda are very, very interesting. Samyak Yoga, Ayoga, Ati Yoga, Mithya Yoga. In any panchakarma you can write. Okay. Ayoga means signs of inadequate, niruha or asthapana, same. Ati Yoga, signs of excessive niruha or asthapana, same. Klama, I have already explained a few minutes back. Weakness in spite of, without doing any exercise. Without doing any exertion, you are tired. That is called as a klama. Exhaustion or lassitude. Admana, that is distinction of the abdomen. You know Adman and Atop. Please write down another word, very interesting. Adman and Atop together. Atop means lot of sounds in the abdomen. Atop. Adman is only fullness, but atop is more peristaltic movements and lot of gurgling sounds in the abdomen. There is barbarism, something, the word is that, barbarism or barbarism. I don't remember the exact word, but lot of sounds are there. Atop. Okay. Hikka, hiccup. Hrita prapti, pressure on the cardiac region or the heart region. Urdhva gamana, upward movement of the medicine. Pravahika, dysentery, like amoebiasis, sticky stool. Pravahamanasya pravahika, lot of straining, pravahana. Shirashula, shira means head, shirashula, headache. Angavedana, full body ache. Parikartika, fissure in ano. And paristrava, that is discharge of pitta or rakta. Let us go slowly up. Okay, I will try to mark this last few para. Tikshna basti. When basti becomes strong, when gomutra, pilu, chitraka, sendava, yavakshar are added to the other basti dravya, that basti becomes tikshna basti. And what is mrudu basti? Basti becomes strong when kshira means milk, madhura, sweet, and shita dravya, cooling effect, are added to other basti dravyas, then that becomes the mrudu basti. In simple words, some another information I would like to give you. For santarpana janya vyadhi, write down. Santarpana janya vyadhi. Santarpana janya, SANTAR, Santarpan, PAN, Janya, JANY, Santarpana Janya Vyadhi. Diseases because of the overnutrition. Please write down. Santarpana Janya Vyadhi, diseases because of the overnutrition. For example, obesity. In that Santarpana Vyadhi, you can use Tikshna basti. Now, second disease type, apatarpana janya vyadhi. Apatarpana janya vyadhi, diseases due to, yes, undernourishment. That is some diseases like, for example, in the village places, because of the vitamins and protein deficiency, there is a marasmus, protein calorie malnutrition. Kwashiorkor, protein deficiency. Kwashiorkor. Marasmus, protein and carbohydrate, both deficiency. In the patients of tuberculosis, in the patients of cancer, there is weight loss. And whenever there is a weight loss, that is apatarpana janya vyadhi. And in that, you have to use the mrudu basti, soft, gentle, okay, medicated enema. Now we will go further with this thing, next page, like that. Okay. So, basti administered to the pakvashe removes the vitiated dosha from the whole body. This is a very important statement. Write down. Why? Because many patients think you are giving through the rectum. Am I right? Am I right or wrong? And then you are giving through the rectal region. That dravya will only occupy that large intestinal part or little bit small intestinal part. So the action will be only on intestines. But it is not true. That is absorbed to the capillary circulation from the blood, and these dravyas effect is seen all over the body. Because Vata dosha is like a neurological problems, brain problems, nervous system problems. So anywhere the body can affect it, but everywhere, even if you have for example, cervical spondylosis, you can give basti. If there is a headache problem, if there is a migraine problem, if there is Alzheimer problem, you can also use the basti, no problem. Motor neuron disease here, myelinated sheath gone. For that motor neuron disease, very, very crippling and very dangerous disease. There also you can use the yapana basti. Yapana. Please write down. Yapana basti. That is called the nourishing basti. Nourishing, making strong to the human body. Especially this is useful in autoimmune diseases. Autoimmune diseases or degenerative diseases use the yapana basti. So, my dear friends, in this particular lecture, we tried to see the complications of Vaman and Virechan and also the basti. But now we will talk little bit more detail about these things, if possible, if the time permits. So first I will start with this chapter number 6. Okay. So this is regarding the chapter number 6. Just wait, my dear friends, and I would like to tell some things more in this chapter. Chapter number 6, Charaka Samhita Siddhi Sthana. Okay. Here they have also given the benefits of Snehana and Svedana. My dear friends, try to understand. In this chapter number 6, they have also given the benefits of Snehana and Svedana. Just I would like to narrate those particular shlokas, that is number 11 and 12. Please write down. Charak Samhita Siddhi Sthan, chapter number 6, श्लोक number 11 and 12. स्नेहन स्वेदन और शोधन के लाभ. Carefully listen what simile example they have given. जिस प्रकार चिकने पात्र से जल, चिकने पात्र से, वेसल है, उधर ऑयल लगाया मैंने, चिकने पात्र से जो पानी डाल दिया हमने उसके ऊपर, इसमें डाल दिया, तो जल बिना परिश्रम के ही गिराया जाता है. ठीक उसी प्रकार स्निग्ध शरीर से औषध द्वारा कफ आदि दोष निकाल जाते हैं. जो अनदर एग्जाम्पल ही हैज गिवन, जिस प्रकार गीली लकड़ी को अग्नि चारों तरफ से सुखाकर नष्ट कर देती है, उसी प्रकार स्निग्ध पुरुष के शरीर में स्थिर दोष को स्वेदन करके अपने स्थान से विचलित कर देता है. what is the benefit of fermentation? It will take away all the attach the waste products or the armor in the shakha extremities, mucous lining. जिस प्रकार कपड़े का जो मैल होता है, हम जब वॉश करते हैं कपड़े, तो जो मैल होता है वो क्षार मतलब सोडा आदि लगाकर, सोप लगाकर उनको उत्कृष्ट होकर जो मल निकालते हैं हम कपड़े के द्वारा, यहाँ पर जो मैला रहता है ना, वो सोप लगाकर वो निकाल देते हैं और जल के द्वारा वो निकाल जाता है. उसी प्रकार स्नेहन और स्वेदन से उभरे हुए मल संशोधन औषध के द्वारा बाहर निकाले जाते हैं. ऐसा उन्होंने एक एग्जाम्पल तरीके से दिया है. ठीक है. उसके बाद और कुछ इंपॉर्टेंट श्लोक है उस अध्याय में, तो उसके बारे में हम थोड़ी सी चर्चा करेंगे. यहां पर ऐसा है कि स्निग्ध और वृक्ष विरेचन के बारे में तो वी हैव ऑलरेडी डिस्कस्ड अबाउट स्निग्ध एंड स्वेदन. अभी जस्ट नाउ वी हैव डिस्कस्ड द बेनिफिट्स ऑफ स्नेहन एंड स्वेदन. Then we have also seen the problem when you give the Vamana or Virechana in Ajirana, that is not correct. Then what are the benefits when you take in a proper dose medicine? That affects in a very good, that means easily they can clean your body. There is also in shlok number 17, please write down shlok number 17. They said that the patient also must be psychologically in a good condition. If the patient is having, for example, kama, krodha, bhaya, lobha, then that particular medicines will not act properly. So whenever the patient's psychology is stable, that samyak shodhan can take place. In shlok number 17 and 18, please write down shlok number 17 and 18, you make the notes. Charak Samhita Siddhi Sthan, chapter 6, shlok number 17 and 18. Vamana Virechana Vidhi has been described. Vamana Virechana Vidhi. For example, the day previous to the Vaman and Virechan, we give the Kapha Vardhak but Laghu Ahara. Kapha Vardhak plus Laghu Ahara, more liquid in nature. In the Virechan, that means if we want, this is for Vaman. But if we want to give Virechana, the day before Virechana, the diet should be Laghu, that is easy to digest, and warm, not the cold one. Then, because of this, the diet you give Kapha Utkleshak Ahar, because that Kapha Utkleshak Ahar will help the Vaman process in the next day. And that Kapha Utkleshak Ahar will not damage your body because it is automatically going out through the process of Vaman. Okay. Then Samyak Vamana Virechana Lakshana. Samyak Vaman and Virechan Lakshana are given in shlok number 19 and 20. Please write down 19 and 20. Vamana, when we give the Vamana, first Vikrita Kapha will come out. Please write down. After Vamana, Vikrita Kapha will come out, and then Vikrita Pitta will come out. In Vamana, in Virechana, the next line, write down in Virechana, first Vikrita Pitta will come, and then Vikrita Kapha will come. Okay? Then I am just trying to see any important shloka for you. In shlok number 22 and 23, first line, please write down 22, shlok number 22. We are discussing Charak Siddhi chapter number 6. Samyak Vamana benefit. Samyak Yog, Samyak Vamana. What will happen? Then there is a Jatragni Vriddhi. Please write down. Your digestion capacity will improve, not immediately. Within a period of week, within a period of 15 days, your digestion will be definitely improved after this proper Vamana. Because till Vaman, till the day you give Vamana, that Kapha has been acting as a obstruction. Kapha Urut, all the Agni is covered by the Vikrita Kapha, and then that Vikrita Kapha is removed and Agni is stimulated back. Okay? Then there is very important shloka. Please write down shlok number 24. Shlok number 24, we are discussing Charaka Samhita Siddhi chapter number 6. And I am giving you shlok number 24, Sansarjana Krama. Please write down, this word is very important. Sansarjana Krama. After Vaman and Virechana, this is the diet principle of Ayurveda. Diet principle, Sansarjana Krama. You must give from light diet to the normal diet. Light diet to the normal diet. I am stopping. I am taking pause. I am speaking slow. Why? Because you are expected to write. In Sansarjana Krama, in dietary advice, 2 words are important. Please write down Yavagu. 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 And second, Yusha. Yusha. In the oral. This all the information is very useful for your subject of Kaya Chikitsa in the last year, for your subject in the Panchakarma last year. Very benefits by hearing Deshpande's lecture. Yavagu is prepared from rice. Please write down rice. And Yusha with green gram, mugachi dal, moongi dal, Yusha. So there are 3 types of Yavagu. I have also previously mentioned, you hear my all records. Mand, Peya and Vilepi. 3 words. Mand, Peya and Vilepi. Mand, Peya, Vilepi. Mand means only rice water. Boiled much more amount of water, little rice. And rice water is manda. Then little bit water content less, then little bit soft rice, peya. Or rather, there are some water, but there are some grains. And vilepi is like a soft rice. Then in the Yusha, green gram is cooked. And there are 2 types. Akrita Yusha and Krita Yusha. Akrita and Krita. Please write down these words. Okay. Next shloka important is, please, chapter number Siddhi chapter number 6, shlok number 26, 27. 26, 27, that is Jirna Aushadha Lakshana. Jirna. aushadha, lakshana, symptoms of properly digested that medicines. What will happen? There are 2 or 3 words. First is anulomana. Vatanulomana. Normal peristaltic movements. Vatanulomana. This will be the effect. Then second effect is swasthya, healthy condition. Current, because there is a dosha samya. Then there will be hunger, proper hunger, bhuk, kshit, trishna, proper thirst, manasvita, energy, utsaha, mental freshness, then laghuta, sharir laghava, then indriya vimalata, clean perception of the sensory organs, eyes, ear, nose, they will act very good. Okay, so these are the effects of jirna aushadha lakshana. Okay, then I am finding the very important shloka for you, if it is there. Most of the things we have covered here, but still if it is something remaining, then I must try to find it out. Okay, then I can see there is not much than whatever we have discussed here. We have discussed the that paristrava hetu lakshana chikitsa. Then we have also discussed the jivadan hetu, jivadan, blood, jiva rakta and rakta pitta. But here only I would like to tell you one important thing. For example, Charaka Samhita Siddhi chapter number 6. You write down, there are some important shlokas as like 79 and 80. 79 and 80. This is regarding the Jiva Rakta and Rakta Pitta Pariksha. Jiva Rakta, please write down 2 words, Jiva Rakta and Rakta Pitta. Jiva Rakta means normal physiological blood, and Rakta Pitta is a Dushita Rakta, vitiated by Vata Pitta Kapha, Dushita Rakta. Jiva Rakta is a normal physiological blood, and Rakta Pitta is a Dushita Rakta. So they have given again the animal experiments at that time. They were, Guru and Shishya both were living in the jungle forest. So they have given Charaka Samhita, Siddhi chapter 6, shlok number 79 and 80. How to examine this? This is Dushita Rakta. So they say that Charak is saying that give that blood sample, not in the laboratory, but give it to the food mixed with that blood and give it to the crow or the dogs. Crow or the dogs, these animals. And if they do not take that particular food, then that is called as a Dushita Rakta, because the animals are very clever. Their perception is very clear. They think, this is not the good food because it is mixed with the Dushita Rakta, and they will not take the food. So take it that this particular blood is not good. Okay. Next, what we can tell about Saptamo Adhyaya, that is a Basti Vyapada Siddhi. Okay. In that Basti Vyapada Siddhi, I have already told you the 12 Vyapada over there and how to treat that Atiyoga Chikitsa. That also we have discussed little bit. Then Klama, we have discussed about the Klama Hetu, then Admana, then Hikka Hetu Chikitsa. So different complications, how we can treat those complications. You can also make the notes by your original, whichever the textbook that you have. But I'm just taking the note what is there. Shirorti Hetu and Chikitsa, Pravahika Hetu and Chikitsa, Ang Arti Hetu and Chikitsa. So these are the different Parikartika Hetu and Chikitsa, Paristrava Hetu and Chikitsa. All these things are given in this particular chapter number 7. Okay. For example, Klama. Klama means the tiredness without getting exertion. Here, when the doshas are having sama and you use, the mrudu medicines, soft medicines for niruha, then it is not properly eliminated and they are living in the body, and so klama is there. For that, you have to give the pachana, rukshana and svedana chikitsa. Please write down the principle. I am talking about klama chikitsa. Klama chikitsa. Pachana, rukshan and svedana. Okay? Pachana, rukshan and svedana. Some medicines that they have given, vacha, vekhanda, calamus, suntha, ginger, dry ginger powder you can use. Then also you can use the trikatu. And Charak is saying that you can use the different alkalis mentioned in the Grahani Adhyaya. Now I am talking about Adhman. Please write down. Complication of basti. We are discussing Charak Siddhisthan next chapter, chapter 7. There, Adhman, when there is a dosha, too much prakupita dosha, and the patient is also krura koshti. And if you give the very soft type of basti, then vata will be diverted from the normal tract. That is called as a vimarga gamana. And because of that vimarga gamana, there will be adhmana. Okay? Here, what you can do, the Charak is advising phalavarti. Please write down this word. Phalavarti, your rectal suppository. Please write down the translation. Phalavarti means rectal suppository. Next complication is hikka. This is opposite. The patient is mrudukoshti, patient is alapabala, but you are giving tikshna, aushadha, siddha, asthapana basti. That means for the delicate person, you are giving strong treatment. That is creating the hiccup. Here, Charak is saying that bruhana type of treatment should be given. Bruhana. For example, he says that you can use some anuvasana basti prepared from triphala. Please write down triphala and bala. Then after anuvasana basti, the patient for the hiccup, you can give dhumapan. Write down the dhumapan, not dhumrapan. Dhumapan chikitsa. And also you can give some milk, medicated milk and jam, avaleha. Okay. Next, he has given the treatment for shirorti, that means head problem. Whenever the patient is very weak, krura koshti, and very severe tivra dosha yukta, and you are giving very soft type of the shita basti, mrudu basti, then what is happening? That vayu is obstructed with that basti dravya. And then there will be problem with the whole body like manyastambha, galastambha, karnanad, karnabadhirya. These type of things happen in the shirorti, upward part problem. Arti means problem. Here, Charak is advising the oil massage, tailabhyanga. He also advised when the problem is upward. Here they say the dhumanasya. Sometimes you can use the pradhamananasya with trikatu churna or vacha churna. I think this is enough for today. Discussion on the Charaka Siddhisthan, chapter number 6 and 7. I request all of you to prepare your own notes based on the previous question papers. Thank you very much. See you on the Monday at 7 p.m. with the Roga Nidana lecture. Thank you very much and take care.